All right, we're going to go ahead and get started. I want to welcome everyone to meeting 4 of the Committee on Health and Family Services. Today is February 10th, and we have a few items to consider. I think first things, we will go ahead and take the roll, and then we'll take up the regs.
Representative Bentley. Here in the room. Representative Bowling. Representative Bray.
Present in the room.
Representative Birch. Representative Dotson.
Present in the room.
Representative Elliott.
Present in the room.
Representative Fleming.
Present in the room.
Representative Frazier Gordon.
Present in the room.
Representative Marzian. Representative Gibbons Prunty.
Present in the room.
Representative Rayburn. Representative Raymond.
I'm here.
Representative Riley.
Present in the room.
Representative Sharp.
Present in the room.
Representative Sheldon.
Present in the room.
Representative Tate.
I can't believe he's retiring. Sheldon.
Oh,
It's probably it's just a big pain in the
Say.
oh dear.
Steve, I can't believe retired
Representative Weber.
Present in the room.
Representative Westrom. Representative Wilner.
Here in the room.
Chairwoman Mosier.
I am here in the room.
Wonderful.
Okay, we have a quorum established to do business, and I just want to once again thank everyone for being here. We have some important business to take care of, and first, I would like to review the block grants that have been presented to the committee. Everyone should have received those ahead of time. Are there any questions? All right, no questions, no concerns. We will consider those reviewed for this committee. And then we have some to consider some administrative regs which have been referred to us. And the only reg that I would like to briefly explain, and it's not a problem, it's just an explanation, is 902 KAR 2460E. It is the Essential Visitor Program regulation, and a brief explanation is that this emergency administrative reg was filed on October 1st of 2021, and it was set to expire on January 31st, 2022. And so concurrently, when we came into session, we passed Senate Bill 25, and that was signed into law on January 14th, 2022, and it also extended several emergency regs, administrative regs related to the COVID-19 pandemic until June 28th, 2022, and this regulation was part of that. But when we passed Senate Bill 100, which was signed into law on February 7th, 2022, it brought the provisions of this regulation and the Essential Personal Care Visitor Program, which was temporary, it brought it into permanent status, and it was codified. So the cabinet and I'm sure everyone from the cabinet on the call knows that you need to be sure that when the new emergency reg related to Senate Bill 100 is filed in the next 2 weeks, that it's not in conflict with the previous emergency reg. And if so, then today's regulation should possibly be withdrawn at that time. Does that make sense?
That is correct. We are ready to withdraw once we get everything else ready for the new one.
Okay, very good. Thank you. Okay, are there any other questions or concerns about any of the regulations which were referred? Okay, seeing none, we will consider those reviewed. And thanks very much to the cabinet for being on the call in the meeting to help us clarify that. Okay. The first bill that I would like to take up today is House Bill 282. an act relating to healthcare service agencies. Representative Steve Riley. Just make your way to the table. If you have any guests, please, everyone introduce yourself for the record.
Thank you, Madam Chair. I'll introduce myself and let my guest, and then I'll give a brief synopsis, and then let her have some statements, and then we'll take any questions you need. Steve Riley, House
Move
District.
your microphone a little bit closer, please.
You sure?
I am.
Steve Riley, House District 23.
And I'm Betsy Johnson. I'm the president of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living.
House Bill 282 provides for greater transparency on the costs charged by staff agencies working in long-term care. It requires staff agencies to register with CHFS and disclose ownership and other relevant information. It sets standards for direct care staff contracted with or employed by the Healthcare Services Agency. It does not prohibit agencies from operating in Kentucky and does not set the price that staff agencies can charge for their services or how much they can pay their contract or employer direct care staff. And so at this time, I'll let Betsy describe more of the bill, and then we'll take any questions after that.
Thank you, Representative Riley. Thank you, Chair Moser and members of the committee. Our association proudly represents around 275 facilities across the Commonwealth of Kentucky and across the continuum of care for elder services, which includes skilled nursing facilities, personal care, and assisted living communities. I want to thank Representative Riley for introducing House Bill 282 and for listening to the issues that we are facing in long-term care today. Throughout the pandemic, we heard from our members about what I would consider large bucket issues that ebbed and flowed throughout the past 2 years. In the beginning, it was no PPE, no testing, and the issues moved to reduced census and financial strains. And then my phone started ringing with members alleging that they were being price gouged by staff agencies. For those of you who may not know, staff agencies contract with or employ direct care workers such as nurse aides and nurses, and then contract them to healthcare providers such as skilled nursing facilities. Staff agencies were utilized but not preferred by long-term care providers pre-pandemic, and we do recognize that there is a need for their services. However, we believe the best scenario is when direct care staff are employees of the long-term care facility to ensure continuity of care for the elders being served. However, due to workforce shortages that we faced during the pandemic and today, staff agencies have become an everyday necessity. And unfortunately, during the pandemic and today, the cost of hiring agency staff has skyrocketed. My job requires, among other things, to find solutions for the problems my members face. And often that requires me to go to a governmental agency or the legislature to do so. When I started to hear staff agency price gouging allegations from my membership, I turned to the Kentucky Attorney General's office with the approval of my executive committee, and I filed a COVID-19 online price gouging complaint. I received a call from the AG's office letting me know that they had reviewed my complaint, but unfortunately, staff agencies were not included under the price gouging statute found in KRS 367-374, and therefore they did not have jurisdiction over the matter. The price gouging statute does cover medical supplies, but not healthcare services agencies. House Bill 282 would put healthcare services agencies under the price gouging statute enforced by the Kentucky Attorney General. I also learned that there is no oversight of healthcare staff agencies in Kentucky, even though these agencies employ or contract individuals who care for the most vulnerable citizens in our Commonwealth, and ultimately, through contracts that they have with skilled nursing facilities, receive taxpayer-funded money through Medicaid and Medicare. House Bill 282 creates basic standards for healthcare services agencies. House Bill 282 is an accountability and transparency bill that is needed in Kentucky. And as Representative Riley said, it does not set the price that they can charge, nor does it limit what they can pay those direct caregivers. We do value our direct caregivers and believe that they do need to be paid accordingly. But it helps us level out the playing field because we are dependent on Medicaid and Medicare dollars, so we can't raise our prices, unlike healthcare staff agencies. Our association fully supports House Bill 282, and I'm happy to answer any questions that the committee might have.
Okay. Do we have any questions? No questions, no concerns? Representative Sheldon.
Yeah, I felt like I needed to say something. Yeah, I'm back. I was curious, the price gouging side of it. Can you explain a little bit more? You talk about when it comes to charging for their particular services, they're raising the prices up on you. The staffing agencies are not allowing you to kind of compete for that full-time employee kind of thing.
Exactly. So, again, we've used healthcare services agency or staff agencies pre-pandemic, but just like I'm sure you all were hearing, PPE costs were going up, and clearly the Attorney General's office was hearing that too, because they did create that COVID-19 online complaint form for price gouging during the pandemic. And so what I'd learned, even though I filed a complaint, we don't really know how much they're pocketing as profit and how much they're paying the direct care worker. So say pre-pandemic they would hire a CNA and pay her or him $12 an hour. Maybe they're paying them a little bit more, but the prices have really gone up. And so again, we're calling this a transparency and accountability bill because that will highlight those issues, and then it'll be up to the Attorney General to determine whether it's price gouging or not.
Gotcha. Thank you very much.
Representative Wilner.
Thank you, Chairwoman. And Representative Riley, you always bring us good, reasonable legislation, and so I'm predisposed already to support this. But I just wanted to check to see if there was, if there were any concerns from any of the provider groups about this bill, and if those are conversations that you've had.
No, ma'am. I've not heard any complaints whatsoever from anyone about this bill. No, ma'am.
Thank you.
And Representative Wilner, just to let you know, staff agencies are vendor partners of ours, so they pay us dues. And so we are willing to take this issue on, even though they're officially members of ours as well. And they understand. And this is happening across the country. I think there's 16 states considering similar legislation. So it's a national problem.
Thank you.
Yeah, thank you.
Okay. See no further questions?
Motion on the bill.
Comments? We have a motion and a second on the bill. Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling? Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Yes. Representative Frazier Gordon?
Yes.
Representative Marzian? Yes. Representative Gibbons Prunty?
Briefly explain my vote. I just want to thank you. I heard from nursing home administrators in my district that this was a real issue, and I appreciate you bringing it forward, and I appreciate you for having the bill, and my vote yes. Thank you.
Representative Rayburn? Representative Raymond? Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Representative Weber?
Yes.
Representative Westrom? Yes. Representative Wilner?
Yes.
Chairwoman Mosier?
Yes, ma'am. Awesome. Okay. House Bill 282 passes with favorable expression. The same should pass on the House. Thank you very much for this good piece of legislation.
Thank you.
Thank you, Madam Chair and Committee.
Thank you. Okay, next we are going to take up House Bill 174. I will be joining Representative Cantrell at the table as the primary co-sponsor, and I will hand over the gavel to my co-chair.
Thank you, Madam Chair. Thank you to the current Madam Chair, who's my beloved seatmate, and thank you to this Madam Chair And
Just introduce yourself for the record, and you may proceed and introduce your guests.
thank you. My name is Mackenzie Cantrell. I'm your colleague from Kentucky House District 38, and I will let everyone else introduce themselves. I'll introduce the bill and take any questions.
My name's Christina Libby. Sorry. My name's Christina Libby. I'm from here in Frankfurt.
And I am Representative Kim Mosier from the 64th District.
Thank you. And members of the committee, it's my honor and pleasure to present to you House Bill 174 for your consideration. It is a 7-word bill. It is a short bill, which I think a lot of you will appreciate, but I think it's going to have a big impact for mothers across the state of Kentucky. It's a fairly simple concept. It is extending Medicaid coverage to postpartum mothers up to 12 months after they give birth. Of course, they have to otherwise be eligible for Medicaid. None of the rest of the statute governing eligibility has changed. The only part being amended is extending that coverage so mothers can stay healthy with their newborns for up to 12 months. Thank you for that. If my guests could have just a few moments.
Hi, thank you, Madam Chairs. I'm Christina Libby. I'm here from here in Frankfurt. I'm the Health Outreach Navigator for the Homeless and Housing Coalition of Kentucky. I'm a community health worker and a connector, and the mother of 2 currently in Canto-obsessed children. But in 2019, I was a small business owner on Medicaid when I found out that I was pregnant with my second child. I gradually closed my business and finagled myself a job as a server at Bourbon on Main here in Frankfurt, where I worked all that summer up until I gave birth. After about 8 weeks, I couldn't afford to be off work any longer, and I was lucky enough to know a friend who was hiring for an office job, which would have more predictable hours, more flexibility, and better logistics for pumping, and also health insurance. I was so grateful to have health insurance in my postpartum to cover not only my amazing midwife, who saw me through multiple bouts of mastitis, but also mental health care as I experienced severe postpartum depression. Luckily, it was diagnosed and treatment began early because it actually had began in pregnancy. But while treatment began early, mental health issues are not one and done doctor's appointments. Therapy is ideally an ongoing event, and the decision to go off of mental health medication should not be dictated by a time-limited policy or regulation. And I realize that with this particular topic, there will be a time limit regardless, but my ability to navigate the bureaucratic logistics of copays and deductibles and delightful hold music was exponentially greater with a 1-year-old than when I was 2 months postpartum, when I still had a waddle in my step, a baby in my arms, and a voice in my head saying, "What have you done?" So while I understand that this isn't a large number of mothers necessarily that this would affect, the effect on the children raised by healthy and functioning mothers would have a ripple effect throughout the Commonwealth. Thank you.
Thank you for your testimony. Are there any questions from the members? Seeing none? Oh, okay. Representative Dotson.
I'd just like to thank you for bringing your testimony to us today. I can attest to the fact of the severity of postpartum depression, as my oldest daughter, after her second child, went into severe postpartum depression and got to the point where she didn't even want to live anymore. So, I just want you to know I appreciate your strength for coming and sharing with us today, and you have our full support. Thank you.
Thank you for supporting her.
Any other members?
Madam Chair, if I may just quickly, just for background's sake, I want to thank everyone, first of all, for consideration of this bill. It's very important. Kentucky has a very high maternal mortality rate, and this really should not be happening in such the only real industrialized nation in the world. We continue to have high maternal mortality rates. Kentucky is one of the highest, and there are a lot of factors, but this will really help a population who often sees healthcare disparities get the care that they need. So it's very important. Everyone has a letter from ACOG in your packet in support of this, so happy to entertain any questions.
Representative Fleming.
Thank you. Managing a mental health center, we see quite a few folks come through and just part of the depression and going through postmortem. I just want to say thank you very much for stepping out into the light and showing a little more perspective on what's going on with the women that go through this process. But like I said, stepping up and demonstrating what y'all go through and so forth, it's really much of a role model, and I would say thank you very much.
Any other members? Madam Secretary, please call the roll.
Representative Bentley?
Yes.
Representative Bowling? Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier Gordon?
Yes.
Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Representative Weber?
Yes.
Representative Westrom? Yes. Representative Wilner?
Thank you for the bill and for the testimony. Yes.
Chairwoman Mosier?
Yes, ma'am.
The bill passes with favorable expression and should do so on the House floor. And thank you and congratulations.
Thank you. Thank you all. You're more than welcome to sign on as co-sponsors.
Okay, thank you. We will move on in our agenda. We do have House Bill 349 listed on the agenda. We had quite a few questions and will possibly be working on a committee sub, and so we are going to table this for today. You will see it again, so not to worry. I apologize to folks who came in to talk about this bill today. We are happy to continue all of the discussions about this. So we will move on to, for discussion only, we have House Bill 142, and I'd like to invite Representative Callaway to the table and any guests. If you could introduce yourself for the record and introduce any guests that you have, and please proceed. This should be a very informative discussion. So,
thank you, ma'am. I'm Josh Callaway, State Representative for the 10th District of Kentucky, and I also have Miss Julie Rice as well that is remotely joining us today, and I appreciate her being willing to be a part of this. And so I kind of want to hit some highlights about what the bill is, what the bill does, and then let Miss Julie get more into specifics about the product and why we're trying to do what we're doing. House Bill 142 really is a straightforward bill that simply adds a substance called kratom to a list of drugs that are currently illegal in the state of Kentucky. Already Alabama, Arkansas, Indiana, Rhode Island, Vermont, and Wisconsin have banned this product that's called kratom. Basically, it is defined as a psychoactive substance that is technically legal in the United States, and it is in the same family as the coffee tree. Kratom can be abused in many different ways. It can be abused in the chewing of the leaves that come from the plant, brewing them in tea, mixing it in other drinks. It can be taken in powder form. It can be taken in tablet form. A lot of times it's extracted down into a shot form and taken that way. And from a lot of the studies that have been done on this particular product, it has a stimulant effect in low doses. So if you took low doses of the product, it could increase energy, talkativeness, less need for sleep, and then higher doses of kratom are said to have an effect similar to morphine. It works on opioid receptors and some of the brain's chemical messengers related to emotional regulation and pleasure. Kratom abuse is on the rise in the United States, and I'll let Miss Julie talk a little bit more to that in just a minute. But I do know that it is under review with the WHO. The FDA has it right now under review, and the DEA has it listed as a drug of concern on their list. And so kind of gives a little bit about what it is. And Miss Julie, I'll let you go into some more detail and let the guests know today, or let them know today exactly what this product is and what it does and kind of what you're seeing from your side.
Julie, if you could please introduce
My name's
yourself
Julie.
for the record first. Yes, thank you.
Okay, my name is Julie Rice, and I'm an APRN. I am medically trained, and I am psychiatry trained. So I have an FNP and mental health degree. So if you haven't heard of kratom, it's a tree, and it's from Southeast Asia, and it has these psychoactive properties that people are using as far as a stimulant goes. And then some people are using it for pain. And what I'm seeing is that the rise in the abuse of this is like tripled. And, when people take this, they get that stimulant and then they get that sedative type factor. And when you talk about like the heart, so medically, I'm seeing issues with heart rhythm, with liver, with kidney, so much so that like liver damage and liver failure, kidney failure. And because at the very basis of like how we prescribe, it's just kind of a known thing that you don't prescribe a stimulant with a benzo. And that's kind of the same thing we're seeing when we with kratom. It's kind of a mixture. It's telling your heart to speed up and slow down at the same time. And so we're seeing it causing all kinds of different effects. A lot of people like to compare this, I guess, to marijuana. The leaves have these veins and they're different colors. And so when you go to pick from this tree and make the kratom, you can't be for sure on what you're getting from these leaves because there's so many different types. And so I would say this with the, as far as in comparison to marijuana, because I get a lot of people saying that, the withdrawal is like a huge concern. I do not really ever have patients in my addiction because I treat addiction. I don't really see a whole lot of the withdrawal causing, having to be hospitalized. I'm seeing a lot of increased blood pressure, sweats, vomiting. I have patients tell me it's worse than fentanyl to come off of. And these people are spending, mortgages to get this stuff. I have went in all different gas stations to talk to these people that sell it. And I have had people tell me that they just quit their job over the whole thing because they have seen kids with fake IDs. They just seen so many addicted people come into these gas stations and they feel so bad selling it to them. And so I feel like in the true botanical form of kratom, you're getting one thing, but when you start not knowing what strands you're getting and you're mixing them and to sell them in gas station form, you're getting you don't know what you're getting. And so I do not see that much, withdrawal effect with the marijuana. I do see, anorexic, depression, suicidal ideation, all these things in my psych world. So it's not even coming at me just medically, or it's coming at me from the mental health aspect and the medical aspect. I see it, I bet I see 50 people that I've had to send to treatment for kratom alone. And then I'll just go out and it's not just professional for me, it's personal. I am divorced, and my husband, my ex-husband, he spent 30 grand of our money on kratom, and he's a professional and he got addicted. He's now getting clean and he's doing well. But I just want to say that this has no stop Like it can affect it. And it just starts out with somebody saying, you know, I want a little bit more energy in the morning or whatever. And they go and they stop and get it. And then their families, they are, you know, it's just wreaking havoc on families in Kentucky. And we're considered to be such if you have a Kentucky degree in nursing, you are allowed to practice in so many more states because we're considered such high professionals in our testing and it's how we practice. And so at the very basis, when we go to look at stuff as Kentuckians and we see things like what outweigh benefits that outweigh the risks, that's the basis of how we prescribe. That's the basis of how we practice. And they just do not even come close to outweighing the risks.
Thank you very much for your testimony. I really appreciate that. I think it's you know, a very interesting kind of look at something that we don't know a whole lot about. And I know that Kratom has been around for a while. I know that there are probably advocates out there who would say that they're using this to wean themselves off of opioids and that it's helping them stay clean. And then I hear from treatment providers who say that this is increasing the relapse rate. So, I think that there are still a lot of questions out there. The FDA hasn't really officially weighed in on it. And I just wanted to be able to share some information about this topic today before we take a vote on it and before we make a decision as a state about how to handle this. I know that we do have some questions. I'll go ahead and call on our members, and maybe we'll have some more for you. Representative Sharp.
Thank you, Madam Chair. My question is, how prevalent is this in Kentucky at the moment?
Do you want me to answer that, or do you?
Yeah, go ahead.
Okay. It is off. It is. They can't keep it on the shelf. They're selling out of it. They've had to go from small packaging to extra large packaging just so that when one person comes in, they can feed their addiction enough for the next person. So, I mean, it is just, 1 in 2 patients of mine, and in the industry, I'm having, so in Hancock County where I live, we are known for our industry. We have Century, we have we have Southwire, we have Domtar, we have Alaris. We have all these. I'm having head, managers call me and say, hey, I hear about you in this Kratom. It's a problem here. It's all over the place. In our kids' walking parks, there's Kratom bottles all over the trails. There is Kratom all throughout, schoolyards. So it's somehow getting in the hands of our children. It's somehow getting, into every single business. There's people that have, wrecked the cranes, and they didn't have anything in their system, but yet when further investigated, they had been taking the Kratom. So there is no way to, get these people help, because technically in Kentucky, it's not illegal.
A couple follow-ups.
But yet when they come to me, sorry.
No, that's okay. So in Kentucky, it's not illegal. Has it been illegal in other states? You may have said that, and I missed it earlier.
Yeah, it
Indiana.
is. Indiana, Alabama,
It's illegal.
Arkansas, Rhode Island, Vermont, Wisconsin have all banned it, made it illegal there.
Okay, and the DEA and the FDA have not weighed in on any of this yet?
They have it on their list of concerns right now, and they are.
Okay. Well, I appreciate you bringing this to the committee here. I think it's very important, and to get ahead of any substances abuse that we can. We saw what happened with the methamphetamines in the early 2000s, where we were behind the power curve, and it sounds like we're a little bit behind the power curve on this one too. So I appreciate you bringing this. Thank you, Madam Chair.
Representative Riley.
Thank you, Madam Chair. If you don't mind, I'd like to have 2 quick questions. Question number 1 is, a lot of drugs have slang names or nicknames. Are there any of those for Kratom?
No,
Okay.
no.
Second question.
Because people
Go ahead.
are really ashamed of people, because people are like, you know, it's legal. From every single person that I see as far as my addiction component of my practice, they say to themselves, they're in tears and they're saying, you know, it was over the counter. I just assumed that this was okay until they've lost everything they got. And then they come to me and say, I can't stop this. Because when they do, they get the vomiting, the sweats, the blood pressure raising, and they have to keep going to their job. So they can't even get help to get off this because it's not considered illegal.
Okay. My second question is, can you vape Kratom?
No.
Thank you.
I mean, not to my knowledge.
Mine neither.
Okay, thank you. Representative Prunty, do you have a question?
Yes. Thank you, Madam Chair. Thank you for your testimony. When I served on the Severe Mental Illness Task Force, I had some of my law enforcement folks and reach out to me, and they were part of a discussion. And so I went to the jail one Saturday and to observe a young lady who was being detained, and they told me in the conversation there that they see a lot of frequent flyers in the jail, that some of them, like, their personality has completely changed after they use Kratom. Have you seen that in your practice? Never to return.
Oh, yes, because it has that synthetic. Here's the thing about the gas stations, you know, and it's true, because I'm a holistic, I would consider myself a very holistic person. Both of my parents are pharmacists. I'm very educated with pharmaceuticals, and I am actually, to be a family member, I was a pharmacy tech for years, and for my parents to be pharmacists and me to be in that world, none of us are we are all about changing lifestyles versus chemicals as much as we can. And so in its true botanical form, straight off the tree, could it have some benefits? Absolutely. But as Americans, we all know we fail with containing what we eat. We overdo everything. And when you put the synthetic chemicals in whatever they're selling and you add it to that, you have no idea what you're going to get, what receptors that's going to hit your brain. And it will cause schizophrenia. I've seen people present like a schizophrenic.
Thank you, Madam Chair.
Representative Dodson.
Thank you, Representative Callaway, for bringing this to us today, because I feel like I've lived in a bubble here because I've never heard of it before until today. But I have a couple quick questions. Thank you, Madam Chair. But you said it come from Southeast Asia, a tree from Southeast Asia. So is product made in Asia and shipped here, or is it shipped here in its raw form to be able to be made into synthetic product?
Both.
Okay.
Both. People are getting it and bringing it to their own laboratories, just like marijuana. You know, these farmers, they grow their own, they get their own, but then they tweak it. And so that's the same with here. They can, you can buy, just like we can get pharmaceuticals from other countries. But how safe is it? How safe do you know what you're buying? Like, do you know what you're going to get each time? Like I said, each little vein in these leaves present to you another, like a stimulant. So let's say we have a leaf that has 3 of the same color. You might get a really potent stimulant. Okay, well, let's say it has half and half, and you have one that's a high and a low. You're looking at a heart problem.
Right.
Real quick. And so, and like you said, you never heard of it. My, the person in my life that was affected was a professional, and in fact had a client tell him about it just in passing, that he just took it as a vitamin. And that's how it started. And this person had no issue, never heard of it. So that's what's happening. That's how it spreads so quick, because people just think it's something holistic and it's better than, heroin.
Right.
But we can't just chalk it up to that.
So when you say you purchase at a gas station, what product is it that you purchase at a gas station?
Well, you can.
A lot of
You can
times,
get it in so many forms. You in capsule.
Okay.
You can drink. You
And what-
can get it in these huge bags.
a lot of places is not labeled. It'll have a K and then shot or something like that beside it, and you have to really look to see what the product is. There's not hardly any labeling on it at all. But once you hear about it and you know about it,
Right.
you'll start seeing it
Gotcha.
in places as you go in.
Thank you, Madam Chair.
Thank you. Representative Wilner.
Thank you, Madam Chair. This is a topic I know very little about. I've never heard of Kratom until a year ago. And just this week, a couple of days ago, I noticed a big Kratom shop had opened right down the street from me, big neon letters, Kratom. And I'm really interested to know if you guys can point us to any objective studies. Are there any? Has the, I know that it sounds like the FDA has not really addressed this yet, but there must be some objective studies out there somewhere.
Yeah, if I can present them, I have a whole file of, studies. I have other people's testimonies, but as far as evidence-based, I can submit that to Callaway. Or
I would
whoever.
I would love to see
Absolutely.
those resources. Thank you.
Sure.
Thank you, Representative Wilner. And I would just add that the NIH and DEA and various national organizations do have some information on this. You can Google Kratom and all sorts of things will come up. There is the American Kratom Association. It's an interesting topic, to be sure. I wanted to be able to talk about this today because so few people really know about it, and yet it's being sold far and wide across our state in gas stations. There's a bit of a push to put in some consumer protection laws around this, but I'd also really like the FDA to weigh in on this and tell us really what it is and how dangerous it is. I've had conversations with our Kentucky Office of Drug Control Policy about this, and I've seen it kind of creep into the market. So just wanted to have kind of an educational forum on this today. So we do have Representative Elliott. You have a question?
Thank you, Madam Chairman. And I wasn't going to say anything, but I've co-sponsored this with you, Representative Callaway, and I had never heard of it either until I had a family in my district who reached out to me. Their son was actually a client of mine, and he went from a six-figure job as a software engineer to living with them under an adult guardianship because of what they didn't know what was going on really at the time, but they determined that he had started buying this substance from a local gas station and had abused it to the point of where he couldn't manage his own daily affairs. And so we are hopeful that he will eventually have a return to normalcy, but it's been devastating to them to see what effect this has had on his life, and they'd never heard of it. I'd never heard of it. But I appreciate your efforts moving this forward because it's quite extraordinary what, and not in a good way, where someone can be, use this substance and abuse this, and then they're at a point of where they can't even manage their daily life, medications, finances, had multiple wrecks, accidents. I mean, just a really sad case.
Yes,
and
sir.
so hopefully he's able to return back to normal. But it really opened my eyes to something I knew nothing about. So thank you, Madam
Thank you,
Chairman.
Representative Elliott. And if I may say this, a couple things. One is a lot of the argument when it comes to this product, people will come to me. I've had multiple emails, and they have made this statement to me that I can take this in place of heroin and not have the withdrawals. somebody makes that statement, just logically think about that. That's why the FOP supports this bill. That's why the Chief of Police endorses this bill. Kentucky League of Cities endorses this bill. And that's the reason why. From a logical standpoint, we have to do something. We've got to get in front of this as much as we can. It's already out there, and we have to make sure that we address it. And the most important thing is that most of these places do not card anybody. That some stores have their own policy that they will take your date of birth. Most of them do not. And so children, teenagers, even adolescents are buying this stuff off of the shelf, and we have an issue that we need to address.
Thank you very much. Representative Bentley, do you have a question?
Yes, thank you, Chair Lady. I'll try to stay quiet today. Do you have any facts on salmonella poisoning with kratom?
Is this me?
Yes, ma'am.
Yes. So I have not had any, I don't have anything on that. Doesn't mean that it's not.
The reason I ask, most products that come from Southeast Asia have the potential of having salmonella on them and cause severe problems in the United States. So that was the reason I was wondering. I think that would be a concern of mine, would be salmonella poisoning. My other question is, do we know exactly the toxic level for it to be toxic in blood level?
I have not had, so like when you go to test, so it's a new test, in fact. So I've added it now to my drug panel because honestly, this is over the past couple years, I'm just like you all, I didn't know it had existed till I started addiction medicine. And it is insane what I'm seeing, but now I've just added it to the panel. And so they just give you different levels. So as far as like a blood alcohol level or anything like that, the data hasn't come back to give you, because I kind of have wondered that myself, like if it's gonna be out there, like at what levels are dangerous. I've kind of wondered that myself, but no, I don't have that data yet.
One more, Chair Lady. Is Narcan effective against kratom at low doses and high doses?
It's not effective at all.
Thank you. Thank you, Chair Lady.
You're welcome. Thank you. Yeah, I mean, a couple things that I'll just add. This is why I think it's really important for the FDA to weigh in on this substance, because there's so little that we know about it. We don't know toxicity levels. We don't know risks versus potential benefits. We don't know what sorts of products are or this is being adulterated with. So how to handle this is still really up in the air. It's not looking great for kratom, in my opinion. I'm not seeing that there are a lot of benefits to this. And, I hate the fact that our children can go in and purchase this without any sort of check or balance. So I wanted to make sure that we start talking about this topic, that we get folks educated about this. And this is not going away. I think I'm not sure what exactly happens to this bill if it turns into a consumer protection. I hesitate to even do that, to legitimize something that we know so little about. That's my problem with putting a consumer protection in place. Is there any value at all? But of course, the minute we say that, we have people who swear by it. So, I'd like to know what those safety levels are, if there are some. It just doesn't seem like something that's great for Kentucky right now. We have a question from Representative Fleming.
Thank you, Madam Chair. I'm interpreting your comment earlier that this plant can be grown here in Kentucky or in the States.
Well, I mean, any plant, I mean, yes, I mean, it can be. However, like sometimes people will get the leaves themselves and then bring them over is what I was in my reports that I was told that, you know, as far as like growing the tree, I was told more that it was the leaves that they get the leaves because you get different types of kratom with every single different leaf. Okay. So depending on the leaf you get, you could tweak it to what, however, in these laboratories, they're tweaking it to whatever they're trying to make. Because if you go into gas stations, you can buy different kinds. And so, but the problem is the benefit, the only benefits that it has, we have safer options in Kentucky. So it's not like there's not a benefit. It's just, it's so small that we have safer options.
Okay. Thank you.
Thank you. Representative Birch.
Chair, what kind of plant produces this? I mean, is it a tree?
It's a tree.
So what?
It's a tree.
Mm-hmm.
What kind of tree?
It's an Indonesian tree, a tree from Indonesia, and they actually take the leaves, and that's where they extract the product from, off the tree.
It's called Mitra guinan.
Right now, it's introduced to this country by importing it, right?
Yes, sir, mostly.
We don't produce it here anywhere that they know of.
We don't. There are people that do in a lab type setting or a homegrown type setting, but it's very minimal.
But it would seem like the government would, if they know this, would prohibit it, the import of it right now. And I don't know how you put a felony, I guess it's a felony charge against somebody that we haven't said it's illegal. How do you do that?
I think that's what we're trying to determine is if we need to say that. They haven't completed the studies yet, and they have it on, a couple of the groups have it on a watch list. Some of them have it listed as a drug of concern, but they have not done the studies yet to look at benefits versus risk. And because of that, we're saying that we need to be in front of that.
Well, the reason I asked this, back in '74, I voted to criminalize marijuana. Now states are coming back and decriminalizing it now, saying that, because so many people, they can't control it anyway. Now, I just don't know if we're doing the same thing with marijuana, then we make it illegal, then it starts being imported and it becomes another business for the cartel. Now, how do we do that? I mean, we may be creating another. I'm not saying I'm against this bill but the same token, it seems to me this is going to be hard. To the way it's set up.
I think we have to stand by.
Yes, sir.
I think we have to stand by our convictions. And like as a medical provider and a psychiatry provider, when I have these kids and these families day in, just crying to me about not being able to get resources or being able to get off this stuff, and we aren't doing everything we can, at least as a state of Kentucky, we can say we don't support this. And as far as what happens after that, as far as, going, federal and, all these, but it is on every single list as watch this drug, it's dangerous. There's just a matter of time before, it's on there. Because the amount of people I'm seeing in dangerous situations, whether it be liver failure, kidney failure, suicidal, hearing voices, all these things. It's just a matter of time before we have to do something. And as far as the drug cartel and stuff like that, we can still battle those things, but I just don't feel right as a person in my health field to say this is okay, because it's not.
Well, I want to thank you very much, Ms. Rice, for being with us today and giving us your perspective. I think it's really helpful to get this out there. I think that, we've made a lot of strong arguments for the FDA to weigh in and help us here. I mean, they are who help us determine whether something is helpful medicinally or not. And without their guidance, it's really difficult as a state to know how to handle this. So I appreciate all the great questions. I know that we have now stimulated some information gathering perhaps, and that this will continue. Oh, Representative Bowling. Oh, would you like to register a vote first of all?
Yes, I'd like to register that I am here, I'm present. And then I'd like to register yes vote on House Bill 174 and House Bill 282.
Thank you. And then Representative Tate?
Thank you very much, Madam Chair. Yes, I'd like to record my presence and also a yes vote for House Bill 174. Thank you
so much. All right. Thank you. Thank you very much, Representative Callaway, for being here and bringing this important topic to us. And seeing no further business, we are adjourned until next week. Thank you.